At Queen Elizabeth Central Hospital, in the Department of Medicine, one of the services that's offered is the Palliative Care Service. So we cover palliative care needs of adult patients who are on the medical wards. Oh, golly. What we aim to do in palliative care is to improve quality of life, and often that's through pain relief. There is a need for us to improve patients' awareness that pain can be managed effectively over the short or the long term, so that they present when they have problems and that we see them and we try and manage those pain and other symptoms to the best of our ability. I think one of the major benefits of the palliative approach is that we seek to give holistic care to patients. And many of the patients' outcomes are not so much determined by their medical condition as by their social setting. So do they have a guardian, for instance, to look after them in hospital? Do they have enough food to support their nutritional needs? Do they have a mattress to sleep on at home? Is their pain properly managed? So those are the kind of things that in palliative care we can look at. And obviously we can also offer that continuity of care from the hospital back to the home setting, which patients and their families really appreciate a lot. In the home setting, we're mainly reliant on a full-time basis for the home-based care volunteers. So they're people that live in the community, so essentially the neighbours, friends and family of the patients who are going to be doing the full-time care. Some of those we've trained in certain areas, others have been trained by other organisations. And we go in to really be a link to the medical aspects of the care, so the pain relief that the patients will need on an ongoing basis. We would go in and review the patient and the nurses will continue the care along with the home-based care volunteers.
What about pain? Are you feeling pain anywhere?
No, I'm not feeling pain. No.
Are you taking your painkillers?
Yeah, I'm still using some painkillers, but not for headache. Yeah.
Wisdom Moyo is a 24-year-old gentleman. He's Malawian. We first met him when he was an inpatient in the hospital. He was referred to us because he had a very severe headache which was not controlled. And during the course of the investigation, he was found to have a primary CNS lymphoma. He had recently come back to Malawi from South Africa, so he's actually left a wife and children in South Africa. He was a migrant worker down in South Africa. Since that time, unfortunately, he also presented about a month ago with a left-sided stroke, and we weren't sure if this was a new episode of stroke or if it was perhaps related to the lymphoma.
What did they find? Do you know, or were you told what was the findings in the head?
They find the cancer problem. Yeah.
What do you understand when you say cancer? What were you told?
I was worried so much, but there is nobody who can help me about cancer problem. I leave everything in the hands of God to protect me, because there is no anywhere I can find the treatment of cancer.
In the context of having an aggressive lymphoma which has a poor prognosis, we wanted to talk to him about those issues relating to his family and seeing his family members.
I miss my wife and my kids because there is nobody who can support them than me.
Okay, so you were the breadwinner?
Yeah.
The one who's getting money?
Yeah.
Is your wife working?
She was working, but it was temporary.
Here in Malawi, the other range of treatment options are not available, so we perhaps pick up people, obviously many people with advanced disease, but we pick them up perhaps earlier. We try and control their pain and symptoms to improve their quality of life, make their life worth living, but that end-of-life care is mainly done in the community with family, friends and the home-based care volunteers.
We are very happy because of you are visiting us to take time, chat with us.
Thank you again. See you.
Okay.
Within the context of Malawi, many people want to be buried in the village. So if we can help people to get to the village before they die, from a very practical point of view, it reduces transport costs because it's cheaper for a live person to get to the village than it is to carry a body in a coffin in a truck to the village. Traditionally, people are buried in the village in Malawi, so that would be a best place for them to be before they die.